If there's one thing I've learned over more than 20 years of talking to, listening to, and supporting men of all ages, it's that as the body changes, doubts quietly emerge that rarely find space in an open conversation. Many of these men, especially from their 50s or 60s onwards, carry intimate questions that remain unspoken, locked away in silence. One of the most common is this: is masturbation still healthy at this stage of life? Or could I, without realizing it, be harming my body by keeping up this habit? Before we continue with today's content, please subscribe to the channel. That way you won't miss any upcoming videos, and you'll also help support this space of clear and reliable information. Now let's move forward and shed light on this topic that so many think about, but few dare to speak about openly. This concern is more common than one might imagine. Often it hides behind outdated prejudices, fragmented information, and even a certain discomfort in addressing the subject directly. That's why I believe this reflection is so necessary. Instead of being guided by myths, it's worth looking at the science to understand what really happens to the male body when this habit continues into later life. Research shows that many men continue to masturbate even after 60, but do so without understanding the effects this practice has on their hormones, prostate health, or even their relationships. It's like driving a car for years without ever opening the hood. It works, but you have no clarity about what's happening inside. When we examine it closely, we see a range of benefits that are rarely discussed, but can profoundly influence well-being. Masturbation, for example, keeps blood flowing through the penile tissues, helping to preserve firmness and sensitivity, almost like an invisible workout. There's also a direct connection to prostate health, as regular ejaculation helps flush out accumulated substances, acting as a preventative cleanse for the body. The pelvic floor is a network of muscles at the base of the pelvis that supports vital organs such as the bladder, intestines, and prostate, while also contributing directly to sexual function. During orgasm, these muscles contract rhythmically and intensely, serving as a natural, silent exercise. This internal workout strengthens the muscles, improving bladder control and helping maintain firm erections. Over time, many men notice weakness in this area, which can lead to issues like urinary leakage, dribbling after urination, or reduced rigidity during erections. Keeping these muscles active through masturbation is therefore a discreet yet highly effective way to preserve sexual and urinary health, providing greater confidence and comfort in daily life. And it doesn't stop there. Orgasm triggers a drop in cortisol, the stress-related hormone, helping to lower blood pressure and calm the mind. This chemical cascade also releases dopamine and oxytocin, substances that enhance feelings of pleasure and emotional connection. That's why so many men report a wave of calm and satisfaction immediately afterwards. There's also a frequently overlooked benefit of enormous value: self-awareness. The habit of masturbation creates regular contact with one's own body, allowing a unique sensitivity to recognize what is normal and what may be changing. It's like knowing your own home so well that you immediately notice when a light bulb has burned out or a door no longer closes properly. In the case of men's health, this familiarity can reveal signs that might otherwise go unnoticed. Small lumps, firmer areas, changes in skin texture, or even shifts in erectile response become easier to identify. All of this acts as a kind of natural self-examination, carried out without any medical intent, but with practical results. Early attention is crucial because issues such as testicular lumps, fibroses, or inflammations, when detected promptly, have a far greater chance of effective treatment. In other words, masturbation is not just about pleasure. It can also be a preventative gesture, a silent alert that helps a man seek medical advice at the right time, before a problem becomes serious. Moreover, the positive effects extend to sleep.
After orgasm, the body releases hormones such as oxytocin and prolactin while reducing cortisol levels, which are linked to stress. This chemical cocktail creates a profound sense of relaxation, making it easier to fall asleep and reach restorative sleep stages. For many men who struggle with occasional insomnia or restless nights, this process can act as a natural regulator of rest. Another important aspect is masturbation's role in sexual control training. For those dealing with premature ejaculation, it provides a safe and private space to practice start and stop techniques, or explore different rhythms and stimuli. Repeated over time, this practice increases body awareness and helps prolong intimacy with a partner, bringing greater confidence and mutual satisfaction. There is also the question of libido. As men age, sexual desire often declines, but this does not necessarily indicate a lack of interest. What happens is that the brain circuits responsible for pleasure and desire receive less stimulation over time, making the body less responsive to erotic sensations. Masturbation acts as a kind of workout for desire. By regularly stimulating these neural pathways, it keeps the communication between brain and body active, preserving sexual interest, arousal, and motivation for intimacy. In this way, the practice helps keep libido alive and prevents sexual desire from naturally weakening with age.
Perhaps most importantly, masturbation can be seen as an act of self-care. It is not just about immediate pleasure, but about recognizing that sexuality is part of a man's overall health. Maintaining this connection sends a message to the body and mind of respect, attention, and care for oneself, something that remains essential at every stage of life. Of course, all of this should go hand in hand with healthy habits, good nutrition, daily movement, and regular medical checkups. Nothing replaces professional evaluation, especially from the age of 40 onwards, when prostate screening becomes essential. Masturbation, however, can be viewed as an ally, not a threat. The truth is that, far from being merely a taboo or a hidden risk, masturbation can become a valuable tool for physical and emotional balance when approached consciously and responsibly. It is a natural habit that, when understood, contributes not only to sexual health, but also to overall well-being, helping to maintain vitality, self-confidence, and quality of life. However, to have a complete and realistic perspective, it is crucial to acknowledge that risks can exist in certain circumstances. Only by considering both the benefits and potential drawbacks can one build a healthy relationship with their own sexuality, ensuring the practice is genuinely positive and safe at every stage of life. If this content has provided clarity and helped you view the subject more naturally, thank you for your attention. I invite you to follow the upcoming articles and reflections on men's health. Subscribe to the channel so you don't miss any insights. Together, we can break taboos, clarify doubts, and promote a healthier, more fulfilling life.